to PCTV Health Talk Show. We thank you for always tuning in to listen to health problems, health conditions, and what is happening in the health sector. My name is Elfrida Bokiti. As we start today, I would want to give a big thank you to God for making today a success. I would also want to thank our mama, Apostle Mrs. Bernice Ajimam Premfe, for bringing PCTV to life. I want to also thank our papalistic papa, Mr. Benjamin Ajimam Prempe, for being a great pillar of PCTV. As we are coming to start the show today, I would want you to share the link, share the link, tell a friend to tell another friend that PCTV is on and we are on Health Show. Today we are coming to discuss a very interesting topic. I'm sure it's a topic you've not really heard of, but it's a very interesting topic you wouldn't want to miss today. So I would urge you to be glued on your seat. Tell your friends, share the link, follow. We'll be right back. Welcome back to PCTV Health Talk Show. So as I said earlier, we are discussing a very interesting topic. And what we are discussing today is scabies and zoonoses. I'm sure you've heard of it, but you don't really know what it really is. Today in our house, we have Dr. George OSAFO. Dr. George OSAFO is a doctor, is an adjunct lecturer, and then he is a veterinary surgeon. Today he's here to really enlighten us on what scabies is and what zoonosis is and how to really prevent ourselves from that condition. Hello, Doc.
Hi.
How are you?
Fine, thank you.
Thank you so much for always answering our call and coming to us. Thank you so much.
It's a privilege.
Today we are coming to discuss a very interesting topic. Myself, there are lots of things I would really want to know about it. Yeah. So viewers, please bring your questions and we'll answer for you. So Doc, what is really scabies? Can you give us a brief explanation of what scabies is?
Okay. So thank you all to your listeners today. I'll start by explaining from this point rather. If you want to talk about scabies and how it affects the human population, we can't leave zoonoses.
Yeah.
So I need to explain that one before we move to that. Yes. So zoonotic diseases it's a big word, but it just means that you are diseases that are transferred from animals to human beings. That means that diseases that we can get from our companion animals, food animals, and all type of animals. The issue with zoonosis is that now it's becoming a problem, where almost 65% of emerging disease, that means all new diseases, 65% of it are from animals, which means that we are getting to a point where most of the disease we'll be dealing with are zoonotic. So they brought about one health concept where everybody is involved. I think that is why I am here today to talk about the zoonosis, that is scabies. So scabies is a disease caused by a parasite called subcortic scabies. It's just a very small microscopic, that means you can't see it with your eyes. So there's no way you can identify it as a mite. But it is on animals specific or more common dogs. And when you touch a dog, when you go ahead and play with a dog, you can get this disease on your skin, and it's a very, 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 very terrible and excruciating signs that comes with it. And that is what we are talking about today. So it's a disease transmitted from usually our carnivores, because that's where we get most contact with onto our skin, and then it causes the same signs that it causes in the animal on us as human beings.
Okay, so You said a lot of most animals. Can you really be specific with, especially the ones that we have in the house, like the ones that we usually keep in the house? People usually keep cats, dogs, maybe goats, hens. Those are animals we usually keep in the house. So which one specifically can risk us to having those zoonotic conditions?
Okay, so the literature says scabies can go for all animals.
Okay.
But that's why human beings too are affected, being it zoonotic. But the ones that I've seen commonly in my practice, in our practices, goats, sheep, dogs, cats, all those animals that we get in contact with. Especially for the goats, I have a very interesting story. I think I'll tell it at the science part, so that we can get more from that. Yeah.
I see. Okay, so today I would want you to mix a bit of tree.
Okay.
A bit of. Do you speak Ga?
No, I speak tree.
Only tree. Okay, so please, when you are explaining, I want you to add a little bit of tree so that those who don't really understand the English will be able to understand. So, I want to really know what causes it, like the causes of the zoonotic disease.
Okay. So, if this mom we are very, very small, I want to me home. We won't find any home. So, want to me for any home patches, the omoko skin no ase. Because omoko skin ase no, it's very difficult say ode either say we don't sabe fa ho na we hu aboa no, and say unless we cra machine I find a microscope. Untumi
if you did na ode we ni hwema obetumi ade ekete kra obetumi
obetumi na kese am wo hu. Yeah. Enti Samo no omufi omu from animal to animal. It is aboa bi wo bia and obetumi den amount. Sanet nye say aboa bi ahu no ho bia onam bia wo bi.
But how do you know say aboa no will be like how do you know say let's say you have a dog in the house, how do you know that this dog has that
okay, then is here cause science na e show no more.
Yeah,
because scabies no the entire senator say cause a lot of itching.
Yeah,
I mean severe itching. I have seen some cases aboa no itches to a point saying the skin comes off and it keeps on itching because it's very, very itchy. The reason is the aboa bow skin we hear some few minutes, really like 15 to 20 minutes. Now a barrow I call skin as into a call skin as in a barrow no obey here enzyme be a more over to me the bio skin more over to me room. Into a quasi na for the a movie and a movie produce a lot. Into baby or no so itchy bound to me and here one in full skin as so the more I will itch not the more I sell skin.
Does it mean say so say on the animal no? It also is the same say in the skin the animal can also itch sad so that area might no one no a be crow.
Yeah.
Then the animal will be bleeding.
Yeah.
But still the animal will be itching.
Exactly. So that's what I was saying.
Yeah. So it's the same also for human beings.
Yeah, you
would also itch to an extent that the place is like hurting.
Yeah.
But you still want to itch because it is still itching.
That is how bad it is, yes. So they will itch to a point that the one I've seen both in animals and humans.
Okay.
They will itch to a point that almost skin it as now it comes off, but not just comes off. Sometimes you see once the skin your layers.
Yeah.
You will see some of the last one I've seen, the worst one I've seen, last layer of the skin.
Okay.
Wak abwana kama last layer of the skin. Really? And still now gusu kekaho. That one was the worst I've seen. It was really bad. And then a human beings the whole skin was a bumps as a pompo.
Okay, so it means that not every rashes is like it's normal.
That is very true, and that thing that initiates us into the story that I wanted to say. So we had someone come with a goat.
A goat.
Yes, he's a farmer, and he's the farm hand. I don't know what farm horse one. Now, other buy and I say one no answer skin now very scaly, which is one of the signs of scabies.
That's for the animal.
For the animals, human beings so baby a pompon one bones why dry. no honor starting yes scaly patch say as we pra crust abaso no we starting your crust lesions or skin nasi so obaye no dey aponche ne bae no say omu tie test na hwenya aponche no internally but ye fast skin kakra bi e dey call microscope as na ehun say emmo no be bre wo mo ho enti me kwa ka chere no ma me hu say ono nso ne one ne family ni they have been itching but they don't know where it's coming from. Iti be ehwe ne hu me oye ne sase na me hu say ne sahuni na ne chi hu ni na aye pimples be bre na me ka je on call hospital na omo nkofa sample no omo confirm ye and on man drew which I think say be ba ho.
Okay, so yeah, viewers, I think you are learning a lot of things today. I'm sure there are lots of things you didn't know and you are learning today. Myself, I'm learning a lot of things today. It means that not every rashes you see on your skin is just a normal rash or it's heat rashes, so you just leave it like that, or you go and look for rub to put on it and hoping it will vanish or it will go. Not every rash is just a rash. Some of them are zoonotic disease, scabies and all of that. So if you have a dog, a cat, especially those of you who keep your dogs and your cats in your room, some people their pets are dogs, some people their pets are cats. And those animals, they keep them in their room. They sleep on the same bed with them. So if you are such a person and you have an animal like a dog or cat you keep in your room, you have to be very careful. Take the cat or the dog to see the veterinary day in, day out. Let them check the skin, because if this dog is affected with this mites and the dog comes to sleep on your bed, you are so at risk of having the scabies and the zoonotic disease and all of that. So please be careful. Please stay tuned. Don't go away. Share the link to a friend. We'll be right back. Welcome back to PCTV Health Talk Show. We've said a lot, so if you just joined, we are talking about scabies and zoonotic disease. And we have in our house Dr. George OSAFO. Doc, we've spoken a lot.
Yeah.
So now, I want to know how this is treated in both human beings and in animals.
Okay, so I'll start from animals and I'll go to human beings. In animals, what we do is that we have medications that are chewables. Chewables means that they chew it and then it kills, it goes under the skin, takes care of these mites. Then the other thing will be the problem that they might have caused. You know, I told you the itching can go as the third layer, yes. So the other thing is to take care of the skin infections and all that related problems that comes there. So that is usually what we do for animals. We also, for animals like goats, sheep and all that, we have chemicals. So in this point I would say that the mite is not a fly or an insect. And yeah, tuntum and boy be able to make the insecticide, mosquito spray Ekuno and omonye that family no.
Okay.
Mites are from, we call it an arachnid family. It means spider family no mufi. To be far insecticide enkum, but what they are caricide and a big
okay, to say in some
exactly, so no and no now the
very
big
stubborn.
It is a one part caricide name kuna on wuda and an incosia no so enwu. Incosia name wa obesanya reinfection. It is now care about omo pets than is animal. So we take care of when you cry or dear no pano so now or dano and also incosia so to me alcohol. So that is near for animals. No. Human beings no. There are a lot of things that people have tried, but main one if it be permethrin soap or permethrin products. A dry to me kun might no ena inkosiano. Inti ebi mu soap, ebi mu spray, inti omo de mawa, omo chew send ya obe to me dry, na we to me kun abone. First thing is obe kun abone. If in the skin as then you can treat the other skin problems. So those are usually.
So if I get you right, the lesions or the rashes comes like a pimples.
Yeah.
Dot all over your skin. Then it shames you.
Oh, and shames you. Where to say purple as a tuntuma kawa.
Okay.
Or swelling.
Okay.
Yes.
Okay. Okay. So when it happens like that, they give you those treatments. Then you treat the skin.
Exactly.
So with the animals, on the skin, when the mites are there, do you see that the skin is protruding? Because I think I have seen on a dog. We used to have a dog in the house.
Yeah.
And I noticed that there's something coming out. It's not like there was a swelling on the skin.
Yeah.
So I woke up the next day, and the part that is swollen has reduced, but another part is swollen.
Yeah.
So there, I called my uncle to come and check. When he came to check, it was like he's calling the veterinary. The veterinary came to see then he was like, it's mites. But I didn't really probe further to find out. That's why I said I am learning a lot today. Yeah. And I know my viewers are also learning a lot, especially those who have dogs and cats and they let them into their room. I hope you are learning a lot today. So the veterinary came, the veterinary was like, it's a mite that is causing that. So he made us buy a shampoo. They've written mites and like, they've drawn some ticks, that we should bath with it. And then he gave an injection.
Okay.
He gave, I think, ivermectin injection to the dog, and we used that. Then all of a sudden it disappeared. You couldn't see it on the dog. So those ones are scabies.
No, so I don't know exactly what he saw, but scabies, I told you, goes under the skin.
So it doesn't pop up.
Exactly.
It's just under the skin.
Exactly. So the ivermectin helped because, as I say, acaricide, it comes from that family, ivermectin family.
Yeah.
So that one helped with the treatment now, or treaty for that condition. But for mites, you will not see them elevated and popping out. No, what you see is that as a scab, our prayer be about white. Usually, in one whitish, this guy not hair never when in it to feel. Once a good spread they on the skin. That is usually mites. Yeah.
Okay. So talking about the treatments, especially in human beings, those of us who keep the pets in the house and we have no idea about these things. We may see rashes on our skins and we'll see that it's just a normal rash because so say it could be mites on the pets and all of that. Yeah. So when it happens like that, after the medical treatment, does herbal treatment help? Because I know some people, they don't like medical treatment. Yeah. Even when they have malaria, you don't see them taking any anti-malaria. Yeah. They want to go and take herbal concoctions and all of that.
Yeah.
Do herbal medications help in treating this condition?
Okay, so herbal medications are there are some that they have shown to have toxicity. But it's a bit of what to me anya toxic effect or might so. Problem now herbal medication or when I say some of them are not tested to kill the eggs. Once I catch you about eggs, no.
Yeah.
It's all to me adult mice. Now when eggs now, you are just going to have a reinfection. Problem then koda. But stop now me other ones that make an idea. Who use it doesn't just kill the adults. A cool egg no so and a larval stage so that they don't come back again. Exactly. It's in a I won't say like no herbal medicine. That one research negusu koso. But the advice is say if you can get the medical graded one, that would take care of both adults and eggs, then you know that you have done the right treatment.
Okay. Viewers, we are learning and we've still learned a lot. Please share the link, tell a friend to tell another friend. If you have a question, bring it on the comment section. Let's ask talk so that you clear all your doubts, especially if you have a pet and you keep it in your room. Bring your questions, let's answer. We'll be right back. Welcome back to PCTV Health Talk Show. If you just join us, we are talking about scabies and zoonotic disease, and we are here with Dr. George OSAFO. Doc, so I've heard that with the treatment of this scabies and the zoonotic disease, if you are being treated, you start the treatment. If the dress you were wearing in the period where you were having the rashes, the lesions and all of that, it's either you stop wearing it and burn it, or you wash it in a warm water, iron it, or dry it in like a hot sun where the heat can kill the mites, and if there is a larva, if you have a bed, you have to bring your bed out, dry it in the sun, or if possible and you have money and you can afford, buy another bed, like fumigate your old room, because if you start the treatment, you use the cream and the medications and all of that, and you don't treat your clothes, your bed, things you've touched in the room, and you do the treatment and you come back into your room, is that there's a possibility you can be reinfected. How true is that?
No, so that is actually the best way of taking care of scabies, because it's just a mosquito no malaria, simple malaria. Malaria, so who person treating malaria, you catch us okay, what for a drone, do something about mosquitoes in our environment. Say, stagnant water, you drain it. If you have a mosquito net and so on and so forth, the same thing. So we treat only the condition on all human being. Now when treat what the environment has now, you are going to be wasting your time, because a reinfection, you will get it again. So what you need to do is send our kind wash. The reason for the hot water hanging in the sun and all that is most ectoparasites, I said, one or mobile almost skin and more skin, they don't like the heat, or they don't like places where direct sun falls on them. Into yeah, so what the near no call outside, not direct sun cause a bois. But then I make no bois patch say I take care of it. The best way is say soap na make an analysis spray. Who to me the spray so what the whole atade no what the spray so
you fumigate your
whole house.
room,
Very important because I don't think so person call through the pain of scratching yourself. Like it's very severe, and if you don't want to go through that, then you have to take care of both the body and the environment. Now when you say we here and we are, then we will take care of three things. Abuana, of course, say ama onya no, or a friend of formites. That means na onya contact with na unya mites no unya contact with no. Then you treat your body. That's what will help.
Yeah. Okay, so to all my friends and colleagues who have dogs in their house, especially those who keep it on their bed, I keep repeating that, especially those who let the dogs and the cats into their rooms, on their beds, on their couch, and all of that. As Doc has said, it means that you may have to fumigate your whole room, wash all your things, iron it, especially fumigate your room so that you will not get reinfected. Because being reinfected is going to bring up back the whole itching, the whole pain you went through. If you have a dog, a cat, even a goat, any animal you have in the house, make sure day in and day out, let the veterinary check on the dog, the cats, the goats, any animal you have, let the veterinary be checking on them. Let them be taking their vaccination, let them be checking their skin, because you may not know whether it is zoonotic disease or it's just a normal rash. Because most of us will have rashes and we think, oh, na say we are neighbor, so it's heat rashes. And we may eat to an extent where it will destroy our skin. So today we've learned a lot about it. Doc, is there any myth you've really heard about this scabies? Is there any myth you've heard about it?
Yeah. So myths, there are a lot of myths. One is the mosquito spray I was telling you about.
Yeah.
Yes. Some people think, oh, it's a more like a more cow. Till more cow at the end there. When you have mosquito spray now spray what baby oh you're fine.
I don't know what it really is.
Exactly. And then I make a mosquito spray will not work on mites. Over to me sprays now maybe still now the eggs will be there and the adults will also be around. So another one, I think I want to chip this in fumigation. Now fumigation was there are a lot of companies that do fumigation, but almost fumigate generally. Like let's say person be fumigation.
Mosquitoes, cockroaches, and
exactly my be fumigation. But in a can want some no and some other more mutumika or mufim one mutumika human beings no. Say oh yeah fumigation and so be a chemical now on use.
Okay, so the chemical should be specific.
Exactly, because 1 year no now be after that no. We face everything is clear, but
could you please mention the chemical's name, please?
So we have an acaricide.
Viewers, acaricide.
Yes.
That is the chemical. So if you call the people fumigating, there are lots of people who do fumigation, make sure it is acaricide.
Yes.
That is what is going to help with the mites. If they just do general fumigation, it's going to sack mosquitoes, ants, and cockroaches, and the real problem will still be there. Yeah. So viewers, acaricide. Please write it down so that you don't forget. But please continue. Yeah, so
acaricide, that's the drug that helps. Without that, there is no way you can get away with it. Another myth is they use the people will go. So it's been known that neem tree has been able to help with the mites, but so people will go for that one and then use that one to spray and do all other things in there.
So that way, are they cooking the neem tree? Then they'll put the water in the spray bottle and spray, or they'll burn it and they'll sprinkle the.
Yeah, that one is difficult to say because I really don't know what they do. But the point I'm trying to reach is, again, it is research that it has some effect.
Okay.
Some effect. I'm being very careful with my words because scientific world will be a new research on okay. They have an effect doesn't mean it solves.
Okay.
But what we are looking at here is solving, because who identify say mites and I will deal with there. You don't have to play around at all, because especially in color, the adults in crowd to me I feel comfortable, at least you know how to control. But color no itching.
On to me, she had the crowd was school.
Or very disturbed.
Yeah.
So you have to make sure say who was out there now you use the right chemicals to handle that problem, and I think that would be the best way out. Yeah.
Okay, viewers, please, the chemical is acaricide. So if you have a dog in the house, you have a cat in the house, and you notice all these signs and symptoms dog has told us about today, call the veterinary to come and see the dog. Go to the hospital yourself for treatment. Fumigate your room. Specifically, acaricide is the chemical that will kill the mites. Stay there, bring your questions, let's answer, and share the link. We'll be right back. Welcome back to PCTV Health Talk Show. If you just tune in, we are talking about scabies and zoonotic disease. And then we have in the house Dr. George OSAFO. Doc, so we've said a lot today about scabies and my viewers has learned a lot. Me personally, I've learned a lot today because I have a dog in the house. So I think I will be looking out for all these things, and when I see any itching on my skin, I won't assume that it's just normal rashes. I think I have to rush to the hospital to check what it is. And as you said, it's not like looking at it with your eyes, but when you go to the hospital, they may have to take a part of your skin, or they'll do a skin scraping and put it under a microscope to be able to find the particular mite that is causing that. So it's not like you just look at it with your eyes and say, oh, this is just a skin rashes. But you have to go to the hospital for a professional to look at it. Even the professional cry, they may see that this looks like a mite causing
this problem,
the itching, but they may not know specifically what mite. So they take a sample to the lab to find out what it really is. But apart from the skin scraping to find out the mite, is there any other thing you can, any laboratory or any investigation that can be done to find out what it, like, whether it's a mite or what it really is?
Okay, so the other investigation, they are deeper, but you have to start from identifying that you are dealing with a mite.
Okay.
Because in the beginning we said that there are a lot of things that can cause itching of the skin. All the signs I have showed you, most some of the disease can also cause the same type of signs. So you have to, the skin scraping is very important because it just identifies, oh, mites and I'm dealing with. Then for identification of the type of mites and other things, there are other laboratory tests that you can go in for. A lot of other tests.
So where did the person have to actually go to the hospital and let the doctors find the specific thing that is wrong?
First you find if it's mites, then you proceed to find other
mites that
you are dealing with. Yes, because there are many of them. There are many mites available. Today we are talking about scabies because we want to concentrate on one that is causing zoonotics most of the time.
I think that is something very severe that most people who have dogs and cats in the house are really going through, and they don't know what it is. Me personally, I've learned a lot today, and I have a dog in the house, and as soon as I see anything on the skin or on my skin, I'll just have to call the veterinary to see the dog, and I also have to go to the dermatologist specifically, right? Yeah. So viewers, dermatologists, the doctors that takes care of the skin, those are the people that you go to see if you find any lesions or any rashes on your skin, and you think it's skin rashes or you don't know what specifically it is. You go and see the dermatologist, or let's say the skin doctor. All right. So, Doc, we've said a lot, and all too soon we are bringing our show to an end. Could you please give us your final advice on how to take care of ourselves and prevent all this?
Okay.
Thank you.
So, one thing that we have to know is that we are not saying because of mice or go and sack all your dogs and cats from the house. What we are saying is that there are ways to prevent this thing from happening, because the mites, especially scabies that we are talking about, are very itchy. It can cause uncomfortableness. It doesn't mean who rashes, panic, run to the hospital, no. But if it's a consistent itching, you have been having it over a period of time, you have to go to the dermatologist to confirm, say, you are not dealing. Then your pet will have to come to the veterinary hospital for us to see. One thing I would say is that most of the challenges near goats and sheep now, they don't usually pay attention to those things.
Okay, those people, they don't call the veterinary to come and
yes,
see. It's only those with the
cats, and they are more
dog.
Closer, so they more take. So
those
the
are the ones who enter our room. Exactly. The goats, I've not seen anyone letting goats. Anyway, maybe somebody's pet is a goat.
Yes.
So maybe he allows the goats to come to the room.
Yes.
So, yeah.
But it's not too common. So those ones, they just leave them in the barn or wherever they are, and they will start having this small whitish discoloration of the skin, and the hair will come off. Please don't say that goat yari. So what you need to do is, when you see it, call a veterinarian, call us. Let's find out if indeed we are dealing with mites, so that we can stop this progression. The last thing I'll add is, we said all animals. We have also identified in Tama Animal Hospital, C Street Veterinary, we have identified mites in rabbits. That one I did it myself too. So we saw the mites there, very clear.
Wow. But rabbits too are their pets or their animals. People don't really
not pay attention. So if you keep it in
their house,
exactly. So if you are doing breeding or anything like that, you just keep it there. It just grows, gives births and all that.
Okay.
But what they didn't know, that they were holding the rabbits. So there's a high chance that they too may get it. Yes. So all animals means all animals, including us. Let's keep ourselves safe. Let's take care of our pets properly. If you play with a pet, a child plays with a pet, don't say the child should not play with the pet. It's important. When they play with the pet, 15 to 20 minutes interval, they have to either bath or wash their hands before the 20 minutes pass, because it takes the mites 20 minutes to burrow into the skin.
Okay.
So if you wash it, you kill it
so
off
if you
the
have
body.
a pet in the house, when you play with the pet, immediately
you have to wash your hands. If you are going to bath, you go and bath. It helps prevent you from getting, if your dog has it will help you prevent it. So also that one too is important. So please, let's take care of our pets properly. Let's do the right thing for them so that we also will do the right thing for ourselves indirectly. Thank you.
Thank you so much, Doc. Thank you, my viewers, for staying with us till the end of the show. I hope we've learned a lot. If you have a pet in the house and you play with the pet, if you let the pets enter your room onto your bed, when you play with it, wash your hands. If you notice any rashes on the pet's skin, any rashes on your skin that is really itching, go and see your doctor, specifically the dermatologist, to take care of you, and then take your pets also to the veterinary hospital. Please do monthly or maybe weekly checkup to the veterinary doctor to see what is going on with your pet, so that your pet don't end up having the mite without you knowing, and before you notice, the pet will bring the mite into your room and it will affect your whole family. So please, you've learned a lot today. Protect yourself and take care of yourself. Thank you for joining the show, and I'll see you next week. Bye bye.